welcome in the name of BIEN 2025, Biennial of Textile Art at Belo, next to Medvode, in these beautiful surroundings and hospitality that was brought to us by Mojca. Thank you so much, Mojca, and Domačija Lenart. Biennial of Textile Art is a contemporary art exhibition and a program, a knowledge-sharing program, a community program that kind of tries to highlight the impacts of textile crafting and art on well-being. And we were really happy to kind of be part of a bigger initiative connecting art and health in the frame of Culture for Health project. And today I'm super happy that I see you in like such a big amount of all of you. Thank you again for coming. I would like to welcome Pamela Whitaker from Ireland, Aleksandra Schuller from Slovenia, and Jasmina Ferček from Slovenia to debate, to discuss some dilemmas, challenges, important questions about the intersection of art and health. I believe it's an important, as I said, subject, and I'm really looking forward to be put in this context that we are here today. So we have our host, Polona Torkar. I will let you to it now, and yeah, you're welcome to ask questions if you have them, and enjoy. Thank you again.
Thank you, Zara. Thank you for inviting us. So yeah, as Zara said, please welcome to ask any questions. If we have a follow-up to the discussion we might have. To my dear colleagues, I sent a few thinking questions, but necessarily we won't go into everything. As Zala already mentioned, there is a movement now trying to establish the art and health connection, but it's not something new. Perhaps now it's more attested, documented, evidence-based, because in order to actually say that art has an impact on well-being nowadays, or since science, the framework has been established, it's good to have evidence. But nonetheless, we feel, and I guess it's well attested, that the connection of well-being and art has been present since long before. Perhaps I will call you by your first name. I know you work in academic contexts, so I hope you don't mind me skipping that. But I would like to start a bit personally. So, how did you all three get involved into the field of arts and health, and in which capacity? Perhaps even what's your medium of choice?
So my medium of choice is working outdoors, and I work either in gardens or in urban landscapes. I quite often use the walking studio, so I don't work in rooms very often. It's always in civic society or in places where people gather. So libraries, parks, for example, but also cultural centers as well. And I really like to see how people understand their worlds rather than taking them away from the world into a clinical space.
Aleksandra?
What was the question? Yeah.
There were three questions. How did you get into the field?
Okay.
There was an opening about this being a much broader thing that now that it has a movement, and it's your medium of choice. So how did you enter the field?
Yeah. I used to be a performance artist, and I have heard about the field of arts therapies before from my friends from abroad, but basically I was interested in the effect of it because my life was really changed by a chronic illness at one point, and so I was looking for something to help myself, yeah? Interestingly, it was not drama therapy that I was attracted to, which would be somehow, let's say, quite logical consequence from what I was working before. But it was dance movement, and I do use other media, so I also work intermodal, but mostly what I do is a specific approach within dance movement psychotherapy that is called authentic movement. And it's an in-depth or Jungian approach. Yeah, this is what I do.
And actually, I come to this field by being inspired by Aleksandra. I came to her workshop, like whole year workshop of authentic movement, and it was something that I really, it was really beautiful, strong. I come in contact with me. It was healing, inspiring. So, and then we started to talk, and she explained to me that actually in the Slovenia exists the study of we say psychosocial help with art. Sometimes they translate it like arts therapy, but we will explain later where we are with our knowledge and so on. So I was inspired by her, and in the 2015 I entered the master class. It's in a pedagogic faculty, and I started to study for two years, and then I finished master. So I bring in this space, actually I come in this space also in because of another way, because I work for like before from 2011 with migrant women, and at the same time I find a lot of difficulties to be like a lot of challenges to be part of this very powerful Bosnian woman in Jesenice. And when I hear, it's possible to study this and to get more knowledge, how to hold spaces and how to also deal with many things that happens when you are creating with people. This is also why I decided to go to this study. So in Slovenia we call it pomoć z umetnosti, and Aleksandra also started there, her career, professional work. Yeah.
Pamela, can you also add how you personally came to?
Yeah, sorry, I forgot that bit. So I have a political science degree, and I was very interested in training in art therapy. I trained in Vancouver about how to be with people in places that I was very interested in working in prisons and working in institutions where people maybe didn't have their full citizenship rights. And I guess I was hoping that through the arts I could empower people to give voice and activism. So activism in the world is the theme for me in my practice.
Right. So we have a personal experience of two ladies working with the people in need and some kind of empower them to capacitate them. Perhaps we can start by outlining what is really care for in communities, in the societies. So we now know that it's well tested. Political people say we have a mental health crisis. So what's different now? Why the sudden need to talk about it so much? What is care?
So care for me is mobilizing community assets, which is a kind of a key feature of creative health. Which is gaining popularity in the United Kingdom. So whereas I live in Ireland, I teach in the Belfast School of Art, and in that context in Northern Ireland, where we have, I guess, statistics which would suggest we would have the worst mental health statistics in the UK because of 30 years of conflict, sectarian violence, the troubles in Northern Ireland. So it's very interesting you're talking about performance art, because that is actually used quite regularly as a way for people to occupy public space in a way that doesn't feel fearful, or to occupy space in a way that's non-territorial. So care for me, I always think about ecologies and environments. And currently I'm working on a research project that is all about mobilizing community assets. So another word for assets would be resources, or another way of putting it would be places of welcome or public home places or places of comfort, so that the care isn't so much provided by me in the therapeutic relationship, but it's provided and facilitated in the context of a compassionate society, or places where people feel welcome, particularly if they've experienced mental health services and are living with stigma, and a sense of not having even a right to walk in to cultural centres, for example, galleries, museums, leisure centres, recreation centres, like that. So I'm very interested. Again, it goes back into rights.
Perhaps, Aleksandra?
I think that care can be something that we practice, that we embody and enact on many levels, all levels of our lives. And that also when we speak about arts and health continuum, this means that there are different, on this continuum, there are different, let's say, on one part of continuum is this our micro private life, and then is much, much more social life. Yeah, we as communities, different, we are, each of us is a member of many different communities, I imagine. And care can be somehow inhabited, no? And practice in all these levels, and of course including to this radical, let's say, part of this point, or let's say pole with two poles, which is this micro private, yeah, and let's say here this would be for me, let's like clinical environment, yeah, which has artists can do a lot. They can really act as bridge between these two poles. Yeah?
Ok, jaz bom tukaj začela za slovenščino. Se bom najprej obrnila tako nase, a ne, kaj zame pomeni care, ker delam zdaj že poleg, jaz delam v nevladnem sektorju, delam s priseljenkami, delam s socialnimi delavkami, z psihologi, psihoterapeuti. Vedno znova me tako preseneča, koliko malo skrbimo zase, a ne, koliko je tako zadnja leta, no, koliko je v bistvu izgorelosti, koliko je, čeprav to kot neki izvajalci pomoči z umetnosti ali pa kakorkoli s kakšnimi drugimi metodami in tako, vemo, da je to ključno za naše uporabnike, kliente, paciente, kogarkoli, je zelo malo posvečenega nam, ker enostavno ni časa in to mislim tako, jaz to zelo težko gledam, no.
Nam kot osebam, nam kot praktikom?
Kot praktikom, ja. Ja. S tem je zelo težko, ker se sprašujem, a ne, kako, ko v bistvu, ko vstopim v nek prostor, kjer je neka skupnost ali pa ena skupina, a ne, kako prihajam v ta prostor, kako vstopam, koliko sem jaz regulirana, koliko sem pomirjena s sabo, kaj se mi dogaja, to prinašam nekako, v to se mi zdi, da ko delaš z skupnostjo, pride do te regulacije med nami, a ne, ko prihajam jaz v nekem miru, se to lahko prenese naprej, ko ustvarjamo z rokami, se tu začne ta regulacija, v bistvu zaradi tega dotikanja, zaradi vseh teh efektov, ko recimo ustvarjamo s tekstilom. In to tudi potem predajam naprej priseljenkam, kjer je zmeraj tako toplo sprejeto in marsikatera ženska, ki jo srečam, pravzaprav se prvič sreča s tem, da to, kar smo mi počeli danes tukaj, ne, da položiš roko na srce, da začutiš ljubezen, da si kupiš rože sama sebi, da si rečeš, da se imaš rada, da v bistvu to prvič slišijo, ne. Tako da, mogoče tukaj. Ja.
Do I need to translate it shortly? So, in a sense, there is two distinct approaches that are kind of, I can extrapolate from this. So, this individual and also
Polona.
how you as a practitioner
Polona, can you speak up?
come into a community and this community aspect. if I understand. And you also mentioned the continuum, so of care, ever since from, I guess, the home environment, whatever that is for an individual, up to systemic or communal dimension, and also then clinical context, which in a sense returns back to the individual most often. So let's talk about this continuum, if we may. There is, of course, a heated debate in Slovenia now on the law of psychotherapy, because in a clinical context, of course, the way system is set up, and it's meant to set up to prevent damage and good results, or at least a safe environment, of who is actually allowed and in what way to offer care or a safe space to people to offer healing. I figured, when we discussed online, there is a different dilemma. Like, for example, art therapy in the UK is quite recognized, quite integrated in the system. But you also mentioned you are having similar debates in Northern Ireland. So, who can actually provide care for societies or individuals, in your opinion?
Well, within the UK, I mean, any of the art therapies are regulated. So if you were to call yourself an art therapist without having a regulation under the Health and Care Professions Council, you would be illegally practicing. So, but I live on the border between Northern Ireland, and in Ireland there isn't a regulation. So, and I mean, I think what you are bringing up is in terms of socially engaged arts as well. How to keep artists safe, and what kind of educational supports, supervision relationships that we have in art therapy, self-care, professional care networks. What is happening for artists? And I'm not too sure in Slovenia if you are starting courses in arts and health or creative health, but that is coming into practice now. And they can be courses that have a link to clinical programs. The main thing is ethics, risk, and safeguarding. The artist, the practitioner, and also the public. And we have a duty of care to the public. And I guess if when we talk about health and healthcare and health promotion, that duty of care to the public who is delivering care is vitally important in order to safeguard and mitigate against risk.
Aleksandra, can you perhaps Aleksandra, can you perhaps enlighten us or explain what's the debate actually about concerning the acts of psychotherapy in Slovenia?
Yeah, well, in Slovenia we have 4 associations in the field, professional. One is the oldest. It is called SZUT, and it's translated in English as Slovenian Association of Arts Therapists. And this title is a bit problematic because it started from the idea that students from this Pomoč z umetnostjo MA, that this program will develop into direction of arts therapies, and it did not. So the name is there, but actually the real professional competencies of diplomats of this program are more, let's say, arts-based psychosocial support, yeah, as already said. So this is one thing, yeah? And because the field is not regulated, psychotherapy as a whole, profession, well, yesterday, we have to say, yesterday the law passed the first reading, so it goes into the second reading. Mm-hmm. This is good. What will happen, we don't know, but I will focus on arts therapies, yeah? So we have professional association, which is dance movement psychotherapists, art psychotherapists, and also music therapists. And dance movement psychotherapists and art therapists, we are also members of Slovenian Umbrella Association for Psychotherapy. So we do have all the qualifications that are, let's say, even stronger as, for example, in the United Kingdom. Yeah. We are somehow meeting the criteria of European Association of Psychotherapy, yeah, ARP. But we are only few. For example, we have at the moment 4 fully qualified dance movement psychotherapists in Slovenia, and 1 who did finish her MA in UK, but doesn't meet the standards yet. So she's waiting for the full qualification. So this would be 5 in total. Music therapists are a bit better because they do have education, but it's not fully recognized because it's not nationally recognized. It's in a private institution. But they also don't meet all the criteria, but they are working really hard. So I'm very optimistic for them. And there are also the Association for Art Psychotherapy. We have 2 fully qualified art psychotherapists in Slovenia. And one of them is also working in clinical environment. Has a steady job, yeah, but on the position of art pedagogue. And this connects us that it's not only whether what kind of qualification and experiences we have, but it's also how the whole public health system is regulated in a particular country. And at the moment, mostly, as far as I know, music therapists are visiting, I think, pediatric clinic at the moment. They are working there, but as guests from outside. Yeah, so it would be more like on the level of the visiting artist. Yeah. Which is of course problematic a bit, no? But at least they are working and they can do a lot of good. And this colleague, art therapist who is employed, and I did my clinical practice at the Center of Mental Health, also at the hospital, which was not so easy because today with us is Andrea Grom, who was my clinical mentor, and it was really, really not simple to get 7 months of clinical practice at the unit for psychotherapy.
Why would you say? It wasn't easy.
Yeah, why I say this?
Yeah, I mean, can you explain?
Yeah.
I think there's a traditional outlook of the medical profession. I mean, like for example, in our association, when we responded to the strategy for primary health, they seem to only find solutions in having more doctors, not actually so their profession.
Yeah.
More funds for more doctors, not different, any kind of different way their burden of work could be reduced. So one straightforward thinking.
This is certainly, but this we can also see, it's, almost like a parallel process. What is happening in the arts of health field now, I have a feeling, which I'm not really thrilled about what I see, is that in this field it's happening, it's almost like a mirroring of what is happening in the field of psychotherapy, no? Mm-hmm. So I think when we will know, when the process of regulation of psychotherapy in Slovenia will be in the next phase, which I really believe, no, that we will get that law finally. Mm-hmm. I really trust in that. Maybe it will not be a good one. Sometimes I joke it will be a bigger or lesser Frankenstein, yeah? But at least we will have it and then we can improve it.
Yes.
And then also, after the situation, I think we will see how we can embed artistic practice or different ways or the whole continuum, yeah? But things are happening already now. So life, this proverb, they say life finds its way, or the river finds a way, no matter the obstacles, no? Because it's alive.
Yeah.
So no rigid structure can be there forever, yeah? And this is happening now. But it took us more than 20 years for psychotherapy. one more thing. I know I'm speaking now for a long time. One more thing I would like to say, because I think it's important. This is my personal opinion, but I think it's good that we all think about it. It can happen that exactly because what you said, no, to unburden the psychiatrist, yeah, and the clinical psychologist in our system, then occupational therapists are very welcome. And we have to know that occupational therapists, many of them have specialization, or at least some kind of specialization from the arts. So now, in the Slovenian system, who is actually doing? I am educating many occupational therapists. And basically, they are doing the work that basically should be the work of a qualified arts therapist, yeah? But nevertheless, they are doing. And many of them, they are great, and they are also psychotherapists educated. So let's say this is a kind, again, a Frankenstein, yeah? But these people are already in the system. So I imagine it can happen, because this is happening already. For example, those who are from Slovenia, we have this initiative, Artists as Doctors. You know, red noses, yeah?
Yeah.
And for many years, they are very welcome on the pediatric clinic, let's say. But as an art therapist and the theoretic of the field, I have to say that this also has a shadow side, because it can happen that the rigid structure of it will again, let's say, if the fortress will fall a bit with the psychotherapeutic law, then it will soon come up when it comes to the arts. Because I imagine that many doctors would be quite satisfied if they can invite, you know, from here and then some artists, because they come and they go. Yeah? And they are like visitors. So we need to be clever, and we need to understand the idea of the continuum. So, and I think we need to really, because what is happening is that, let's say, artists are thinking, okay, I need to connect with the person of power, and this is the doctor, no? Or this is the clinical psychologist. And the logic is also that if you are a member of the health team, that you do not need to take the full responsibility, as you were saying before. So, but each of us who works in the health system at least, but it would be, let's say, advisable also in the community arts, should have the basic knowledge, at least on the level as diplomats of this program, arts-based psychosocial support. Or, which I would be also very supportive, if we also start modeling UK or the States, they already have MA programs in arts and health. So this could be a way. But if artists should be collaborating with art pedagogues and also with arts psychotherapists, because who can do, I mean, who can offer a very good supervision to the artist? It is, of course, arts psychotherapist, because understands that the communications is on the level of the arts process, which, of course, if you say, oh, this happened today on the, I don't know, we were dancing and something happened, no? And then you have a supervisor, or maybe this is clinical psychologist, whatever, they can tell you, wow, most probably this, what has opened is that kind of dynamic, whatever. But the person doesn't understand the process. So we need a lot of debates about that.
But reading through all different literature, of course it's, the clinical context, the medical context, the therapeutic context already has a stamp of authority. But it also already has consensus around the individual actually needing professional help. So there is a huge amount of people. You talked about burnout of artists who the system might not even recognize in terms of like a long-term employees suffering from low-level depression, absenteeism, So you come to the doctor, who is in our system the primary triage of who is the expert that will get you the help you need. And the usual pathway is, okay, take some antidepressants and take a rest from work. So actually nothing is being done. I mean, take care of yourself. So this is, I guess, also a symbol of how the society is actually framed, in terms of we have too much need, but not too much resources. We need to be careful with our resources, but yet our communities are very production oriented. So go back to work. I mean, get better and do your function as an individual. So this community shift already comes into place. Jasmina, perhaps where do you see the role of the artist? Of course, it's very important that they have knowledge, ethics, as much as supervision, professional, but in the terms of prevention, in terms of general well-being in societies, is there a place for art there?
I mean, I'm the artist. Like I have like 20 years of artistic practice and like 10 or 12 years in practice in pomoc z umetnostjo. So for me, I think me and my colleagues from Olup, we are somehow, we are meeting these people, like you explained. They are coming on now for 10 years. We are doing art, which is participatory, which is community-based, and which has also some phases or some, we know how to create safe space where people can talk or express it by doing art. So maybe we catch there, for example, I imagine this big carpet. I don't know if some of you remember, no? It was 12 years ago, making the carpet in the middle of Ljubljana in Kresija Gallery. So there people just stop by coincidence sometimes, and they start to talk and conversation and express their feelings. And there actually we start to listen also. Oh, these people are telling, okay, they come to do some nice craft stuff, but they are telling us some things that they are important about themselves, how they feel. We see how they miss connections. They find their friends. And then through this experience, it was very powerful. We were there 2 weeks in the Kresija. We start to do more and more art, which on a safe way connect people, mostly women, I must say, because we are in textile, so I have more experience with women. It's more attracted to them. So from now on, we are doing a lot of like safety spaces, caring spaces by textile, where people come, and there we also speak about how they somehow, through me and through Tasha, who is also educated extra, they know that where maybe they can go if they need more professional support, if the art one day will not be enough, or so on. So from here, like making art which connects people and which make them expressing them how they are in their bodies, minds, or whatever. We then, by extra knowledge, like pomoc z umetnostjo or something, we go further on this continuum, and we can now work now we are working for 8 years. We work now in the programs of Ministry of the Work. So and there they test. There we have to prove that we have some knowledge of psychotherapy or some modality like from arts, using arts in health, and so on. So they know that we are doing art, but it was not enough to be artists and to come into this space of supporting immigrants, women. So here we have to know more knowledge, and this knowledge which actually gives me a lot of for me it's safety. I didn't feel any more safety as an artist who is suddenly so many people are coming and everybody is talking about this and that and how to keep this space safety. So that's why I go to study and
Okay. Pamela, you said you work a lot with people who actually don't want to go into the clinical context.
So it was interesting you talking about expertise, because now the expertise in our profession of art therapy is all about experts with lived experience of their own lives, but experts with lived experience of mental health services. So they are the leaders. And in Ireland, in our training program, but also coming throughout the UK as well, is through our professional association, is anti-oppressive practice. And anti-oppressive practice has come from social work, and it's all about transparency in what we deliver and whether a person would like to work in art therapy or in dance therapy or in more of a psychosocial arts engagement modality, for example. And so that experts who have lived experience are leading the way in different kinds of healthcare. It's not saying that, oh, of course you want to do art therapy. It's a potential participant of art therapy saying, what is it? And why do I want to do it? And could you please explain how this is going to help me in my life? This is really new for art because it makes us accountable. Mm-hmm. And in the past, the legacy of our profession, there wasn't that clear communication of what the benefits were. We weren't working with evidence-based practice. It was like, the arts, they kind of make you feel better. But what is wellness, and what will enhance a person's quality of life is the person will answer that themselves, and they make the decision. And they are now experts of lived experience on hiring panels. So it's not, if you're going for a job, a panel of people who are all health professionals. It's people with lived experience saying, do we want you on staff? And please explain what you're doing, explain yourself. So plain English or plain Slovenian language, like plain English is something that is really important now. And this is where I think that particularly creative health has been helpful for me as an art therapist, because they define what wellness is and they define quality of life. They define vitality. And they operationalize those words because they can mean many things. Sure. And then a person can decide. You need to be understandable. And that is, I think, the ethics of that and the rights-based promotion of people giving voice in that way is really changing radically art therapy. And people can decide to go for, we're talking about continuums, they could stay at the front public-facing community art therapy or as a first step, and they can decide to go into the clinical practice. But to start at clinical practice, to start at that, the person doesn't even know what they're going to get out of it. So this is exciting times. Mm-hmm. I think, because we're regulated, the regulation is all about protecting the public, and we have to ensure our duty of care to the public. So the public looks up my name to see if I'm registered. They can also look up my name to make a complaint.
Yeah.
Do you want to add something to that?
No, I agree, because, for example, this idea is sometimes, let's say, artists say, okay, let's have continuum, no? Great. We will be on this side of spectrum and we are there, no? But the point is, what was very clear, what I hear in what Pamela said, no? And this is also my position, but I don't think we will come to that always, but maybe it's also not necessary. What is important is the qualification, but not formal qualification, no? Basically, a real, because, for example, if I choose, I can work in a community setting. But if I choose differently, I will be also able to work with full responsibility in clinical setting. So this is a huge difference, no? So I think it would be great if we could, let's say, start a kind of, I don't know what kind of program, let's say Arts in Health program in Slovenia, that would be also maybe 2-year MA. That would be for artists who would like to gain this extra qualifications, no? This might be attractive, no, to them. But then still they can go, if they would want to, they can go now to pomoć z umetnostjo, which is much more pedagogically, it's on the Faculty of Education, so it has a different focus. But the point is that each of us who works wherever on the spectrum needs to hold the responsibility, and I don't think that solution would lie in matching together one already established health professional and one artist, no? Yeah. But maybe we will start with that. Yeah. Yeah.
I kind of, we will open the floor now for your questions, but I kind of want to end with a reflection on, yes, I mean, I wonder how much debate is actually going around, not how to provide qualified professionals to actually work on the acute or the long-term mental health problems that are occurring in communities or individuals, but also the conditions that are there that constantly make this a very high need. So in all of these debates, I mean, we're always faced only with discussions on ethics, and of course, which is very important, don't take me wrong. But when we talk about responsibility, there is a lack, in my opinion, of discussions on working conditions, on human rights, on actually budgeting, on what are the states or society's priorities, what are the goals, and obviously we're not there. That well-being and health are one of them. We're curing, not actually creating environments where people can prosper So I wonder, do you think in future debates or the vision of this, there will be a movement of artists, of course, sometimes they already do it very good, and also professionals in clinical therapeutic context who are willing to speak about perhaps we should start at the core of the problem. Yes, it's fine. We need to make space for people to weave textiles, to go into communities, and there's not much space. People, I would say, they're tired. They don't have time to talk. They don't have. They're very burdened. So if this all is a redefinition or a way to slow down, to have space to think through your problems, should we have more time as society and people in it? What do you think?
I wanted just to, zdaj bom se povezala z Biennalom, neka kinzalo, s katero se že od 2023 v bistvu pogovarjava o tem, kako pomemben prostor je lahko Biennale. In od 2023 se ustvarja znotraj tekstilnega Biennala v bistvu varen prostor za pogovor, za izkušnje, za izobraževanje na področju uporabe tekstilne umetnosti, letos dodajamo naravo, in se s tem odpira prostor za to, da ljudje prvič stopijo, imamo povabljeno praktično, kot sem od Pamele izvedela, v bistvu trenutno najbolj aktualno likovno-terapevtko, Samnit Alvari, you mentioned that Samnit Alvari is big, you said to me. She's really now completely in United States. So, tako, nisem niti vedela tega, koga vabimo, ona je tako preprosta in domača, tako da imamo v bistvu zelo dobro likovno-terapevtko iz Hrvaške, ki je študirala v Ameriki. Gozdnega terapeuta, ki je hkrati tudi psihoterapevt. Potem, tam bo tudi jaz držala prostor, da karkoli se bo, kdorkoli rabo še kakšen dodaten pogovor, karkoli se bo zgodilo, da lahko pride do mene, se poskrbi. Tako en tak prostor skrbi, res kurirana, z nekim znanjem tudi od zadaj. Tako da, ja, mislim, se mi zdi, da bi lahko bilo, jaz poskušam tudi z UGM-om delati in odpirati prostor in tak tudi pomoč z umetnostjo v muzejih, z umetninami, tako da jaz recimo osebno me zelo zanima, mislim, da imajo zelo lepe prostore, dobre prostore, primerne opremljene za take skupnostne well-being ali pa health prakse. Tako,
So what do you think are the future holds for the field? Is it possible to actually go to the core of it and not just, I mean, it's very important, like I said, to talk about standards and the way the field itself can be developed. But perhaps since there is always a growing need, there are children who cannot get therapists. I mean, I guess.
Yeah, I mean, I guess I think a lot about society and creating these, ambassadors for mental health within society. And I guess this is really kind of a bit of a controversial statement. And I've said it in Northern Ireland because all arts organizations rely on funding. So for us, it's the Arts Council. And only last week, we invited cultural providers to be with people with lived experience of mental health services. And the question is, who curates exhibitions? Who decides on the design of exhibition spaces? Because for me, going into art galleries or cultural, sometimes I don't understand what's going on. I don't know if you've ever had that. I don't understand the language of the exhibition. I don't know where I'm going. It's not signposted. There's no one to greet me when I enter. And a lot of the work that I'm doing on this mobilizing health resources is visiting, when I was talking about the walking studio, I'm actually visiting places with people with lived experience who may never have been in or feel they have a right to go to cultural and leisure events and activities and exhibitions. And we're co-researching. So what would you advocate for in terms of change in this facility? And that's really exciting work. I like being in that kind of work a lot because it's empowering. And then you give that feedback to the director of the Arts Centre, but you're also giving it to the Arts Council in terms of funding. And where we would like to go is to have that creative hospitality within communities. People need to learn how to do it within the arts institutions. And so their funding should depend on it.
Arts therapists were always, I think, quite socially engaged, yeah, because they were, the beginnings were in the 40s or maybe even earlier, no? Let's say art therapy in UK, even after the First World War, no? Not only after the Second. But I think it's important that we whenever we speak about this, that we also bring this wider anthropological or even social perspective, which remains an unanswered paradox, but we should not close our eyes and avoid it. Yeah.
Thank you. Thank you, Pamela. Thank you, Aleksandra. Thank you, Jasmina. So this concludes our talk in the formal way. Hvala zala. And I will invite you all to pose questions in a more informal setting. I guess we've had a chance to open a few pointers of discussion. Thank you.